Thank you. And thank you all for joining us today. It's good to see you all and hope you're well. I just really first want to start by thanking all of our public works, road and fleet crews for their really hard work since Friday to keep our roads clear and all our trucks and equipment running. Also to the line workers, the Snohomish PUD, our cable companies, all our public works fleets in our cities within Snohomish County, first responders. It was quite an event, and we're just very grateful for all the hard work that they've put in over the last few days. So whenever we have these significant snow events, they do just a great job working around the clock to keep our roadways passable and our community safe. So we are very grateful. Thank you. COVID-19. We're focused on safely and quickly vaccinating as many people as possible. I passed by the Evergreen Fairgrounds yesterday, and there were literally hundreds of cars lined up. So it looked like things were going well there, and people are eager to get their vaccine. We're grateful for that. The supply is still not meeting our capacity to deliver it into arms, but we are optimistic that the federal government will increase the amount coming to the state, and we should begin to have an impact. And we are seeing slow increases, but we're also managing to make sure people that need second doses will be able to get second doses. So a bit of a juggling act, but things are improving slowly. We are also focused on ensuring that our harder to reach and BIPOC communities who have really been disproportionately impacted by COVID-19 are able to access vaccines. I had a first meeting last week with a number of community partners to talk about how we make sure that as the vaccine supply increases, we can do outreach events and make sure that people that have difficulty accessing the healthcare system, or perhaps don't drive, or have other difficulties in front of them, are served equally and equitably. So we're working off our standard successful community engagement model that we used during last year's census work, and many of those relationships with our communities throughout Snohomish County really stem from that census work last year. So we'll continue to focus on that, as well as making sure everybody in Snohomish County gets vaccinated just as quickly as possible. Again, some people in our community don't have cars to reach mass vaccination sites. Some don't speak English. Some are skeptical of the vaccine. We really need to work hard to ensure the vaccine reaches everyone, and we'll continue to work on that. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Well, thank you, Executive Summers, and good morning, everyone. The teams were busy over the weekend working to balance the safety of staff and patients with the commitment to keep up the pace of vaccine administration and the need for ongoing testing for COVID-19. On the testing front, the Health District did close all the testing sites last Thursday through yesterday due to the weather. Staff visited all the sites yesterday and this morning to check on the equipment. Because of damage to the tents and safety concerns, testing near Funko Field, the Linwood Food Bank, and the State Fairgrounds is closed today. Those with appointments at those sites are encouraged to contact their healthcare provider or schedule for the Everett Community College drive-through testing clinic today, or to reschedule for any of the sites later in the week. In terms of vaccine sites, the Arlington location was closed on Saturday. That was the only mass vaccination site set to be open that day. The other three locations didn't have appointments Saturday or Sunday, and that's just based on regular scheduling and limited availability of doses, not the weather. The 864 appointments for Arlington on Saturday were rescheduled for today. The Everett, Edmonds, and Monroe locations were open yesterday, most with modified hours. Those with earlier appointments in the morning were contacted and told to arrive at any time during operating hours. Vaccine did not go to waste. The decisions to close or modify appointments were made before any doses were drawn for those appointments. The Edmonds, Everett, and Arlington sites are open today and back to regular operating hours. Those are the vaccine sites. Monroe will open this week once we receive allocation information. We previously mentioned a new appointments system coming online soon. Our team got access to it late last week and are doing internal testing and training of staff. While we don't have an official start date for it, we do expect it to be launching soon. Given the holiday weekend, we don't have total vaccine numbers to share yet this morning, but we do have a preview in that it looks like the allocation from the state for this week is 5,000 first doses and 18,500 second doses. So consistent with the State Department of Health's messaging and strategy, this week is mostly about getting second doses in for folks, with limited availability this week for first doses. Speaking of vaccine data, I know that the Department of Health released a report last week with some high-level demographics, including race and ethnicity data on vaccinated persons in Washington state. We do not have a clear picture yet of those demographics at the county level, and we've asked the state to provide us with that data so we can pass it along to the community, as well as get feedback on how we're doing in that respect. Our team is working with providers to ensure that demographic data, including race and ethnicity, are completely entered, and we're working with DOH to extract the data, but it will take some time to see the results. In other data news, the Department of Health also released COVID-19 outbreaks in Washington state K through 12 schools report. The report includes data about K through 12 schools across the state that experienced a COVID-19 outbreak between August 1, 2020 and December 31, 2020. This includes both public and private schools and all learning modalities. As a reminder, COVID-19 outbreak in a school is defined as a situation where each of the following have met. First, there are 2 or more laboratory confirmed cases among school students and staff at the school. The cases have an onset date within 14 days of each other. They are epidemiologically linked, meaning that it was reasonably anticipated that they spent time near one another while in the school building. They don't share a household, and they don't have other activities or encounters with one another outside the school setting. So 2 cases or more in a close period of time with no other explanation for their contact. The report showed that Snohomish County has had 12 school-based outbreaks from August through December. The total number of cases associated with the outbreaks was just 53. That's an average of about 4 cases per outbreak, with a median, meaning 50% of the outbreaks had 3 cases or less. The Health District has also published its first COVID-19 report for schools. While the DOH report focused on outbreaks, our report looks at total numbers of cases linked to schools. From August 1 through February 11, there were 285 cases in staff or students attending public and private K through 12 schools in Snohomish County. Those cases impacted 201 different school facilities, with the majority of them being just a single case that did not result in further transmission. So meaning the staff or the student caught COVID in the community, it was reported, they were found to be attending school or working at school, but then no further cases occurred in that school environment. With several thousand students, staff, and teachers having returned to the classroom, at least part-time thus far, this report shows that the prevention and intervention measures are working to protect staff and students. Our schools have been working hard to make the classroom as safe as possible. I hope the community keeps masking up and physically distancing so that trends continue to decrease the rate in the community, and that also alleviates the pressure on the schools, reduces the likelihood that a staff member or a student will enter the school with a case of COVID. This school report will be updated every 2 to 3 weeks for the remainder of the school year and posted online under our case counts page, www.snohd.org/case counts, no spaces. That'll be under snapshots and reports. The last update today from the Health District is on two new recommendations that came out late last week from the Centers for Disease Control and Prevention. The first one is around masks. During a study in January, researchers found that two modifications to masks could improve the filtration and reduce the leakage of masks by improving the fit, the tightness around the edges in particular, but also increasing layering to reduce the number of droplets that make it through the masks. And that can protect people around the mask wearer as well as the mask wearer themselves. So there are two possible modifications that CDC is suggesting folks consider. One is wearing a cloth mask over a disposable mask. So the disposable mask goes on like this, and then the cloth mask goes on over it, and that just provides a little greater tightness around the edges, and it increases the filtration. The other approach is to take that disposable mask, tie knots in the strings on both sides as close as you can to the edge of the mask, then put the mask on. That makes it a little tighter on the upper and lower margins. The side margins are still sticking out there, so then they recommend that you fold those in. And again, that reduces leakage. Again, you could always put a cloth mask on top of that to further increase safety for yourself and for others. We encourage people to consider double masking and adding layers, as it may provide additional protection for others and for the person wearing the masks. CDC discourages doubling up of disposable masks, so don't wear two of these together, as well as don't double up anything with a K95 mask. The two most important things, though, are really just making sure that whether one mask is used or two, that they're multi-layer, tightly woven cloth, and that they fit snugly around the edges, covering both your nose and mouth and minimizing gaps around the edges. We must all be consistent about wearing masks and correctly and routinely when we're around people we don't live with. The CDC also indicated last week, this is regarding quarantines for fully vaccinated people, that folks who have completed their vaccination series do not need to quarantine at home if they are subsequently exposed to COVID and they meet all of the following criteria. One, as I mentioned, they're fully vaccinated, meaning they're 2 weeks or more out from their last dose. If it's a 2-dose series, then 14 or more days after their second dose. If later we have a single dose product on the market, then it would be 14 days after that first dose. So that's criteria number one. Number two, the last vaccination occurred 3 months or less from the current moment. And then last, they need to remain asymptomatic since the COVID exposure. So if all those are met, CDC now is liberating fully vaccinated folks from quarantining if they get exposed. If they do not meet all three of the criteria, then they must continue to follow current quarantine guidance, which would be to sit out for 14 days. We are pleased to see CDC's confidence in the vaccine's efficacy and that it is translating into greater flexibility in public health management of exposed individuals who are fully vaccinated. The practical benefits of this greater latitude also provides further incentive to the community to get vaccinated when they become eligible and when appointments become available. So with that, I'll turn it back to Executive Summers.
Thank you, Doctor. Couple questions. The first is, given the report on schools, what is your guidance for school districts on in-person learning?
Well, no change, really. We continue to encourage them to try to get kids back in hybridized, meaning part-time in school, part-time out of school in groups. So that's the same group of kids every day. And that we start with the youngest kids and the high needs kids, get them into the school, spend a few weeks doing that, let things equilibrate, make sure there's no problems, everything's running well, then add on another grade or two, do that for another few weeks, and just keep on going up the scale as long as the situation in the school permits it. You don't see any evidence of ongoing transmission, and as long as our surrounding community continues to have rates that are declining. But even back when rates were higher, we really felt this was the right way to go, given that the prevention measures really do seem to be effective at interrupting transmission in the school setting. So I would say no change in those recommendations that we've been communicating with the schools about for many months.
Okay, there's a question about warming shelters. The Snohomish Health District website, its last update states 2 warming shelters are still open, Everett Shelter and United Church of Christ Shelter. Do those remain open? And what has the capacity been, and how long do you anticipate keeping shelters open? Do you have information on that, Doctor?
I don't know, Executive Summers, and sorry, but we'll get back to you on that. We'll have somebody check out the answer.
Yeah, I'm sorry, I don't know either, except it's really taken on a day-to-day basis. But I think as long as we're hovering, at least out here in the Sky Valley, we're hovering about 34 degrees. So I would anticipate that they'll remain open, but we'll get you that information. Just some question for me. Executive Summers, you said you had your first meeting with some communities of color last week. Seeing how many communities of color have been hit harder by COVID, why wasn't this work started earlier? What sort of planning happened pre-vaccine to account for communities of color who were being disproportionately affected by COVID? Yes, my statement was that my first meeting with communities of color was last week. However, my staff's been working with them for many weeks, and we started planning for this issue really in the fall as we were planning for vaccine distribution. So we, as I mentioned, are building on the relationships that we built during the census work a year or more ago. So we've really been working hard to make sure that disadvantaged communities or hard to reach communities we are communicating with them and working with them, listening to them. My meeting last week was really to hear how we can best make sure that we're accessing them. They have, in many cases, been hit harder. In some cases, there's transportation difficulties. Many are first-line workers and service industry workers. There's some social blocks for some groups. And so we really have to work one-on-one with each one. The impediment right now really is vaccine supply. And so as that increases, we have in the works plans for pop-up vaccine sites, special events, that sort of thing. That's all the pre-work has been done for quite some time. But again, we're working on vaccine supply and waiting on that. Let's see. How much of a challenge is it that there is no phase 3 in the roadmap to recovery? Restaurants say they need at least 50% opening to make it, but there is no clue what the next phase is or how to get there. Doctor, do you have a response for that?
Just a comment. I don't have a window into the state's forecast or design of these phases. That's really something that's happening, to the best of my knowledge, in the governor's office. And I as a public health official, I think the governor's making a statement about wanting to placing a high value on suppressing transmission going forward here in the near term, and just focusing on that and rolling out the vaccine. That's how I interpret it from the health district perspective. But I don't have any insight beyond that.
And just an add on to that, do you think it's time to have a phase 3 option? Okay.
Well, it depends on what phase 3 looks like, I guess. We're certainly have several weeks now of declining rates, hospitalizations, long-term care cases, deaths. On the other hand, we've got an unknown in the new strain, the B.1.1.7. that could be 30 to 50% or even more transmissible. I think work to validate those findings from the UK is still pending here in the US, but I know some investigations ongoing. And so, with limited vaccine supply and an uncertain variant with an, potential to increase transmission again, I can understand the reticence to lay out a pathway that goes too far down the road. But certainly as we see continued improvements and see the vaccine continuing to roll out, increasing the total proportion of people in the county that are at least for the short term immune to COVID, we hope that we'll get corresponding increases in ability for society to function and the economy to try to recover.
Yeah. And I know the state is working on a phase 3 and outlining that. I think it will be helpful once we get that, just to give people some both hope and idea on what we're shooting for. But again, we're still a few weeks into our decline. We want to make sure that this holds with the new variants coming forward. I think staying in phase 2 for a while is probably what we're going to be doing. But we are talking to the state about defining a phase 3, and so hopefully that will be coming soon. Question about older folks worry they're going to be left behind if the state expands who is eligible for the vaccine. Any update on special hours, days for seniors at county vaccine sites?
So as you recall, our call center, which is 425-339-5278, is available to make appointments for older residents without internet access and needing assistance. And we're also talking with community partners to assist us with that. I know that I mentioned during my remarks the scheduling system that we're testing out and trying to get in place, and I believe that has that or this call center will have some waiting list capacity. But I think just to back up and speak to the larger issue, with any group, once we reach a diminishing returns or, half, 2/3 of a group, let's say 1B1, then, we'll open it up to 1B2, but 1B1 will still be eligible. Just as now, when we're in 1B1, if a 1A eligible healthcare worker pops up, well, they're eligible and they get a spot. So it's not, it's not like a window that closes on opportunity. It stays open, and we'll keep vaccinating till everybody who wants a dose or 2 doses gets them. And but we are trying to improve our systems to make it easier for folks who either, in this case, access to the internet, fluency in dealing with the internet, time and patience and all that, or many of the barriers that Executive Summers addressed for other groups within the community. Trying to make it accessible for all is our goal.
You may have mentioned this, Doctor, I'm sorry, but do we know when the new scheduling system will be up and running?
Soon. We're testing it and training staff. I would guess that means conservatively next week sometime.
Okay, Dr. Peters, how long would you expect we need to wait to know whether we will see an explosion of cases due to the new variants? And when might we feel confident that we're in the clear for that particular threat?
Yeah. Well, I don't think we'll see an explosion. So that's the first thing. If it's only, and a lot of it depends on our behavior, right? So both in terms of face coverings, avoiding gatherings, and then our success in rolling out the vaccine, which is effective against this strain. But unbridled, this strain has a propensity to transmit. It looks like 30 to 50% more efficiently than the circulating strains. So it's not something that will, this week it was fine and next week there's an explosion. What we would see is gradually over, I think, several weeks to months, we'll see that strain replace the currently transmitted strains. And, you know, we could end up going back up the type of wave that we just went through during December, January. That's my suspicion. And it could be a little bit steeper when it comes. A lot of that's when and if it comes, a lot of it's dependent on us, because with face coverings, social distancing, and hand hygiene and all that, we can make the reproductive rate of even that B117 less than 1 and still drive it down. And that's really our call to action for the community, is to continue to do that, to buy time while we roll out the vaccine. And that once we've done that and really suppressed the virus, then we'll have the benefit of the pool from which other variants might arise is smaller, right? So just in terms of the numbers, the less COVID that's out there 2 or 3 months from now, the less chances we'll get future variants like this coming up.
Any last questions?
This is Kristen in the Joint Information Center. Thank you again for joining us today and for all of your questions. We are going to go ahead and wrap up. Please stay tuned for future media availabilities.